legacy of the UKPDS is clearly, number one, it's worthwhile intensively controlling type 2 diabetes, both for small vessel reasons and longer term for large vessel. Number two, metformin, which of course if you've got any cash constraints in any international healthcare system, metformin generic is a drug that works well and has cardiovascular benefits. And then adding subsequent drugs, newer studies have shown continuing benefit. At that time, among many people, was cynicism that type 2 diabetes, nothing could be done. Regardless of treating them well, they wouldn't reduce any of the complications, either small vessel or large vessel. The other thing was that there were certain parts of the UK, particularly, where sulfonylureas and insulin were frequently used. Metformin wasn't used in every clinic, and that was because of the hangover effect from the older drug called fenformin. Now in Scotland there was a lot of usage of metformin because a lot of the clinical stuff was done there. So metformin as a drug wasn't routinely used, and a lot of people would have sulfonylureas, and then if they failed in that they'd go into insulin. I think the results of the UKPDS to the investigators were not a surprise. To people that really knew the data well, it wasn't a surprise. But there was a lot of scepticism, and so that was countered by the results of it. Perhaps the thing that came as a biggest surprise, though, was the metformin group. Now, the metformin group, we have to be aware, was much smaller. And so perhaps the benefit was exaggerated, but the metformin group clearly did better. And I guess to this day people are still wondering why that might be. Is it clearly should be other effects other than glycemic reduction, and maybe effects on fibrinolysis, minor effects on lipids, some weight reduction. So probably the biggest surprise was the metformin subgroup doing so well. Once the results of the UKPDS were out, two things happened. Firstly, there was a much more of a drive to try and control people across the board. And secondly, there was a greater usage of metformin. And of course, the three arms in the UKPDS were first-line metformin, first-line sulfonylurea, or first-line insulin. First-line insulin wasn't commonly used in UK practice, but was used a fair amount in places like the US and Germany. So it meant you could move away from first-line insulin, which of course was a benefit to patients, because then they could take tablets rather than injections. As a study, it was the first of the well-designed cardiovascular studies in diabetes. It had some flaws that just represented lack of knowledge of how to run studies at the time, but it's laid the building blocks for subsequent studies like ADVANCE and ACCORD, and now all the cardiovascular outcome trials that we've got based on individual products or individual drugs.